Hi, welcome. You've reached the Unify Child Welfare Domain Expert Working Group kickoff meeting. Over to you, Adam.
Okay, we will start with introductions and then we'll provide more detail on what it is we're doing here. So why don't we start right at that top? Daniel, you want to say hi and introduce yourself, and then call on the next person.
Sure. Hi, I'm Daniel. I'm one of the co-founders of Stewards of Change, and hopefully would like to maybe turn this over to someone I don't know. Carol.
Good morning. I'm Carol Biddle, and I'm joining you from Athens, Georgia, where I've retired after a good many years in child welfare in California. Was the founder and CEO for Kinship Center, which was later part of the larger Seneca family of agencies. And so I've been around for a long time, both in children's mental health and in adoption, foster care, permanency, because that organization did all of those in a fairly large scale.
And Carol is a co-founder with me of the National Center on Adoption and Permanency, which is partnering with Daniel's organization to do this work, which again we'll get into in a minute. So why don't we go to? So I'm the founder and president of NCAP, and I'm a senior consultant for Stewards of Change Institute. So I cross the bridge, or maybe even help form it or something. And so I'm also a child welfare subject matter expert with almost 20 years. I can't believe I'm saying that, experience in that field. I'm an author, writer, researcher, etc. And that's enough out of me. And I've worked with Daniel for a decade closely on most stewards projects. So I know both organizations. With that, Graham is the other NCAP person with us. Why don't you?
Yeah. Well, hi, everybody. Graham Wright from Santa Cruz, California, just south of San Jose. I've been in child welfare in California and nationally for 40 years, I think, and I can't believe I'm saying that. I am happily retired, now a consultant and sometimes expert witness to provider in contested cases in the arena of child placement and adoption. And I'm always interested in development of the field. I was part of Governor Gray Davis's child welfare reform group in the early 2000s. And we worked intensively on changing child welfare from a negative-based system to positive outcome system. And we're very proud of the work we achieved back then.
Okay. Brian, why don't you introduce yourself and then we'll get to the rest of the group.
Sure, I'm Brian Hanspicker. I'm joining you from the bucolic hills of Berkshire County in Western Massachusetts. It's a lovely spring day here. It's getting to be, at least. Perhaps my claim to fame in this group was that about a decade ago, I worked for New York State's Office of Children and Family Services. I was the program architect responsible for a good deal of the work that went into what has become called the Child's Passport, or the Children's Passport, which was a mechanism for pulling together all electronic records associated with the child in state care, foster, juvenile justice, disabled, etc., into a single repository to save that information away until the child turns 18 or 21, separate from their original sources, by the way, which is the real trick. In any case, I'm a senior consultant for Stewards of Change. I do some consulting on my own. I'm lead Project Unify at the National Interoperability Collaborative, chair the Information Exchange for Human Services consensus body under the auspices of Direct Trust. I'm on a whole bunch of HL7 and Gravity Project working groups, all all around the idea of how do we find available human services and enable referrals to them. And now
So
I'm-
that was a lot of tech speak that NCAP folks don't understand, but we'll get there. We'll get there.
My apologies.
Robin,
I'm
you
your
want
secretary.
to
I could have made it short.
Robin, you're up.
Okay, I'm a physician. I'm Robin Yerk. I'm a physician with specialties internal medicine and medicine pediatrics, public health, and health services research. Currently, I'm working separately from the Salk Institute on MD Yerk, which is a physician medical group focused on digital health platforms for physicians. But because I have a master's in public health, I'm interested in some of being involved still in some of the public health initiatives. And I also have a pediatric certification. So with the combination of those two, you know, if I can be helpful with some of the domain experts. With health IT, I have more of a research background, and in all fields, they're introducing health informatics tools to update the methods. So I'm in the process of also updating my methods with health services research. So, but we've participated as a group, you know, over the last year and explored some of the child welfare domains. And so I'm excited to work with the group, you know, on trying to move this forward. So.
Christine, you want to grab it?
Sure. Good morning and afternoon, wherever we are, everyone. I'm Christine McCoy. Like Robin, I'm an MD MPH. I would style myself a family and community health physician. For the past 6 years, I've been running a community health agency that did a lot of maternal child health work and interacted pretty extensively with the child welfare system in New Jersey. As a result, we had referrals going in both directions on a regular basis between maternal child health home visitation and as well as children in early intervention and with special healthcare needs, and kind of worked very closely with the child welfare nurses to unravel a lot of very complicated scenarios. And that led us to apply with one of our local health systems a couple of years ago for a Center for Medicare and Medicaid Innovation project. That's part of CMS that does Medicare and Medicaid, obviously. And they created this program called Integrated Care for Kids and funded 8 states to have 7 years to work on this. And the actual primary outcome of the project is to prevent placement of the child outside of the home. So not necessarily a medical outcome, although that could mean prolonged hospitalization, either psychiatric or physical health. But obviously in many, many cases means foster care or other alternative types of placement. And my co-PI is a pediatrician who had worked very, very long in the field of child abuse and was one of the physician evaluators for the state of New Jersey. So, so really bringing that experience of the last 6 years to the table with this project.
So the acronym, just so everybody gets familiar with it, because it'll come up frequently, for Integrated Care for Kids is INC.
Yes.
Because if you just do the first letters, you get IC. So
You got to integrate your care for kids. Yes.
so it's in INC. Okay.
Right. And
So
we're
can
working actively with multiple states on that project, so you probably will hear us refer to it.
Yeah.
So I just have one question for Christine. Do you work with the Children for Special Healthcare Needs with the Robert Wood Johnson program funding, or is that kind of?
No, so my agency that I'm no longer with, but was for the last 6 years, actually is the provides the local service coordination for children with special healthcare needs for part of New Jersey.
Yeah, I got introduced to that network early in my career, but I was involved more in the adult projects. but I'm familiar with the network, from previous project. I worked on palliative care and which kind of overlaps some of the pediatric issues with children with special healthcare needs for the approach, but the metrics and everything are different.
So forgive me if I mispronounce it and
Yeah.
straighten me out. Is it Asaya or Asia?
Yeah.
Yeah, it is Asia. Hi.
Asia. Okay. Hi.
Hi, my name is Asia Lin, and I currently at NIH as a data scholar. But my role for this project is really to build an ontology. I have a background of pediatrician training in medical school back in China, and I actually involved in the animal welfare, especially for cats. So I involved in like adoption, foster caring for the cats. It's not so complicated as a child, but yeah. So I hope I can learn all the use cases that will help us to build an ontology that can support those health IT architects things, or even just domain knowledge harmonization.
And Rich, last but not least.
Yeah, thanks. I'm really happy to be part of this. I appreciate Daniel, you inviting me to this group. I can see why this was a good fit. So my whole background is all child welfare. So I just started with a new group here recently after 25 years, all child welfare. So from early days as frontline social worker to a director for a large county here in Ohio. Where I continue to serve on our juvenile justice board here and our child advocacy center board, which I helped found here for our county. So continue to do a lot of that work. Recently, so a couple of years ago, a colleague of mine with Casey Family Programs connected me with a couple of researchers, a pediatrician and then a researcher out of Cincinnati Children's Hospital that were looking at addressing the continuity of care and quality health care for children that experience out-of-home placement. And we just weren't doing a really good job of that, not only when they came into care, but then through that process, which I'm sure a lot of folks here are familiar with. So that work led to us trying to figure out a couple things. One, like, how is this information even connected in the first place? And so we've been doing a lot of that work recently, and as we've looked at other places, and I've started talking to Daniel recently, I've just grown very frustrated trying to work internally from within the government side and the public side around how there are a number of folks that are on this call that are out there doing really, really good things. And on the child welfare side, we continue to ask for that help. But then when it actually comes time to work together, we seem like we want to make it almost impossible to actually execute on doing the things that really, really matter. And some of it, in my opinion, I think we're looking at policies and things like that that were created when some of today's technologies that allow security and privacy and those type of things weren't around. But yet we have kids every single day that could benefit from some of this work that are not getting that service. And so I'd asked Daniel, I was like, I'm looking for a group that wants to help solve this problem once and for all, like really get in and if we need to be troublemakers for a good reason, then I'm interested in that work. So
Good trouble.
Good trouble. It's a good trouble committee.
Yeah. Yeah, Carol.
I'm excited to hear about the interest of this group. I spent my early years in child welfare, shaking trees and making changes regarding children with medical special needs and intellectual disabilities who at that time in the 70s were not allowed to be a part of the child welfare system. The resistance was huge. And I did some of the early work and was a significant part of the breakthrough that brought those children into the system so that there is no longer a question, but there still is an issue around quality of service. And I think that's what I'm hearing that this group will be addressing, among other things. Is that correct?
Yes, more or less ultimately.
Okay.
So this is a good segue. So Brian, would you provide an overview? Brian, by the way, needs to get some credit here because there's a lot of work going on that Daniel is leading with his organization. And it was Brian who said, child welfare needs a fix. Let's stand up a group to address that area. And that's why we're here. And so, Brian, if you could just provide a little bit of overview, and Daniel, please jump in with whatever. I see this very much as an organizational meeting, so everybody's on the same page. I don't think we need to do any work today, but we need to understand who each other is and what the mission is and what the work it will entail, straightforward stuff like that. And I just want to assure my crew here that we're not talking about big, heavy, time-consuming lift. That's not the nature of what we're trying to do. I just want to assure people because it will sound like quite the mission that we want to carry on here. And with that, Brian, you want to take it?
First, unmute. I need a T-shirt that says that, unmute. Just so that as I'm looking at myself in the Zoom window, I can be reminded, maybe I needed to have it in reverse lettering, like, on the front of ambulances. In any case, a lot of the work that we have done within Project Unify has been.
They don't know what Project Unify is. All right, you got to back up.
Keep it simple.
And you know what I should probably do, Adam, is pull as we had discussed last week or earlier on this week, whenever it was, I should probably pull up a simple presentation for you guys.
So I'm going to jump in for a second and just give forgive me, the simplest of structures. Stewards of Change Institute is the national organization that Daniel leads. Underneath the Institute, there are other projects and programs, etc. And I'm not going to, and you'll hear references to some of them over time. The one that's relevant is Project Unify, and this work group is part of that project. And with that, Brian can explain a little about Unify.
And I'm going to share my screen here. I'm not going to try to put it into presentation mode, if you guys don't mind, because I'm going to be zipping around. And by the way, Daniel and Adam, this is a presentation from last year, so it may be
I recognize it.
Showing its age just a little bit, but the National Interoperability Collaborative is a group that was stood up by Stewards of Change a number of years ago. At this point, we're starting to get some maturity here, with the intention of enabling collaboration within and across multiple different domains to improve health, safety, well-being, operations, etc., by solving the problems of interoperability. We know, for instance, that it is incredibly valuable to have some insight into what's going on in a child's educational experience from a healthcare perspective. But if we can't find out, if a doctor can't find out if a child is suffering chronic absenteeism, you don't get that hint that maybe that child might have asthma, or maybe the child may have some family problems, parents with substance use disorders, etc. So you're missing out on that trigger to say, this is a child who has some specific needs that need to be looked into more deeply. Same is true between child welfare and healthcare, child welfare and education, child welfare in the justice system. So the NIC was started with the intention to try to explore what the issues are for interoperability between all of these different domains. Now, within the NIC, we started up a working group called I'm getting ahead of ourselves here. Here we go, Project we actually started up a group called Let's Get Technical, which very quickly evolved into Project Unify. The focus of Project Unify was to kind of dig into the technical issues involved with that were standing in the way of interoperability between healthcare systems and human services systems, child welfare systems, educational student information systems, et cetera. Identify what the problems were, what the roadblocks were, figure out how to overcome those roadblocks, and then demonstrate that those roadblocks can be overcome through both demonstrations and specific technical specifications and or pointers off to open source software that helps overcome those problems. As we got deeper into this work, we developed what we call the pinwheel, I think it is, a graphic here that puts the individual, family, and community at the center. I would throw in household as well, given my human services background. And recognizing that there are multiple different information domains involved in providing that 360-degree view of the situation for an individual, family, household, and community, and also how one needs to follow through on providing interventions for any problems that are identified. It's not just health or behavioral health, it's also human services, it's housing, it's education, it's judicial, it's child care, as well as child welfare. It's so we've got many different domains at play in trying to understand an individual child situation, individual family situation that need to be addressed. As we were diving into this, we were introduced to the Integrated Care for Kids program, which was funded by the Center for Medicaid and Medicare Innovations, so funded by CMS, to the tune of, I think, something like $128 million to be delivered over 7 years to 8 different awardees, regional awardees. Of course, Dr. McCoy can correct me if I've misspoken there. It's these numbers live in a swamp of data in my poor mind. But with the intention of kind of pulling together the information that's needed to address the needs of children children whose health is being paid for out of Medicaid, but to properly deliver that health care, we need to be able to pull information in from Medicaid, from healthcare systems, from behavioral health systems, from child welfare and children's services, the educational community, food and housing, courts, criminal justice, and I think we're just poking at the tip of the iceberg there. And by the way, Dr. McCoy, please jump in if you want to mention anything more. I'm about to pivot into what does this mean from a new working group within Project Unify perspective.
I think you captured it, Brian. I guess the only thing I want to say, because it's really important and it's really unfortunate, is that someone sitting inside of healthcare had this brilliant idea. We honestly don't actually know who it was. Whoever they are, they're gone.
We might go after them and hang them in effigy or something.
Right, whoever they are, they're gone. And although they listed all of these things that you saw around the pinwheel and required, one thing I should say is the communities, in order to apply, had to create a chartered organization at the local level with the sign-on from each one of those entities. So even to start working on this, you had to get that local level buy-in to doing this work. The unfortunate part is that they didn't do the same at the federal level. So they didn't go around to each one of their colleagues in the Department of Agriculture and HUD, et cetera, and have these conversations at the federal level. So I just want that to be in the background in people's heads.
So we're doing Project Unify. We're informed now by the Inc. Stakeholders and and Dr. McCoy and others from the New York Inc. program, the Connecticut Inc. program have been incredibly helpful in guiding us, helping us to understand what the Inc. requirements are. And that has helped to inform what Unify's goals, objectives, et cetera, have been. And we've had a lot of other folks involved in this, lots of different participants, many of them coming from a health IT perspective. And so we've got a lot of knowledge out there from a technical perspective as you look over this list. And we have a few lawyers involved too, with expertise in privacy and consent issues associated with information that might be coming out of a healthcare record or out of a student information system record. And we have organized Unify into a whole bunch of different working groups. You'll note that an awful lot of these are technical working groups. It's person matching, and how do we know that that Cindy Lou Who in this system is the same as Cindy Lou Who in this other system? Or, you know, somewhere along the way, did little 5-year-old Cindy Lou Who get misspell her name, and as a consequence end up with 2 different records for in the same system? How do we handle consent for access to that to information about an individual in whichever domain that information happens to be, whether it's health information protected by HIPAA, student information protected by FERPA, child welfare information protected by an abundance of different federal and local laws. Ontologies, we jokingly sometimes say ontology, be afraid, be very afraid, because it's such a complicated word. It's scary, but basically it's, what does data look like for that particular, for a particular domain? You know, user experience, security, architecture, lots and lots and lots of serious technical stuff. The problem is that though we've been very well informed by our Inc. stakeholders, we have not to date really had a lot of subject matter experts within specific population groups. So I think of us as having an integrated care for kids population working group by default, because that's what almost all of our discussions have been around. And yet we know that in order to be successful with, as we move forward through more technical work in support of Inc., that, you know, we actually need to get more knowledgeable about child welfare. We need to get a lot more knowledgeable about educational systems. We need to get a lot more knowledgeable about juvenile justice systems. And that's just around the integrated care for kids aspect of it. We need to get more involved, more knowledgeable about child care, which is yet another completely separate domain. We need to do more about early interventions. And so far, we've just looked at the problems of children. Well, what we're doing in Project Unify is not unique to children. I was at a panel discussion a few weeks back for US Aging down in Washington, DC, where I was presenting to 150, 200 some odd area agencies for aging, AAAs, on why it was important for them to get involved in technical standards. Because an awful lot of the work that they do in doing case management for the elderly, providing services, social services to the elderly, are things that are now being addressed by technical standards in the Gravity Project for making electronic referrals for those services. And in the absence of the AAAs being involved in that very technical standards process, they're going to end up having the wrong things defined by the Gravity Project that don't match up with what they do.
Okay, so Gravity is a technical standards, a federally supported technical standards development project to improve information sharing interoperability, primarily in healthcare, but also some human services. So forgive me for interrupting. What I do want to say for context, and thank you, Brian, is that our work, the NCAP folks' contribution is to provide that expertise so that the solutions that we're coming up with make sense, because you can come up with the best technical solution on the planet for how to exchange, I'm making this up, information between education, the courts, and child welfare. And technically it'll work, and the experts tell you, no, nobody's going to use it. And here's why. You have to do something that takes into account these factors. So it really it's an effort to ground the work in reality, so that when we roll out, when we come up with solutions, that they're actually usable. And that's the hope. That's the aim of this group and of the other work groups, to inform work like Christine was working on in New Jersey, and we've been working stewards in New York and some in Connecticut, to aid and abet in those projects, inform those projects, which are then designed and meant to be models for scaling, for broader learning. You know, we can dream, can't we, across the country? And that is the goal. And Stewards does have terrific connections across sectors at every level, federal, state, and local. So, you know, as we proceed and hopefully are successful, it'll hopefully mean that this has real prospect for becoming reality. And that's what we all are a part of. With that, I'm going to quickly go to Paul Freese, another NCAP team member who came on.
Adam,
Yes, sir.
Adam, you interrupted me 2 sentences before I was done. Can I just finish closing?
Sorry, I thought you were done. Please go on.
No, I was trying to point out that I was sitting at this panel with these folks dealing with aging, the elderly population. I had the chief medical officer of CMS sitting next to me, and I was telling these folks in these AAAs how important it was to get involved in Project Unify, and that we were largely being driven by the requirements of integrated care for kids, a CMMI funded project. And wouldn't it be nice if there was also a integrated care for elders, or INTH project, to which Dr. Hughes, the CMO, said, that's an absolutely great idea. But let's come up with a better name for it. So look for that coming soon. The bottom line is that we within Unify need to develop population-specific working groups, including and especially child welfare. And so you'll see a bunch of these new working groups, I hope, popping up this year. And the goal of these working groups is to be our experts in defining what the requirements are, what the business requirements are for all of the technical work that we're trying to do, so that we do that technical work right. You are our brain trust when it comes to child welfare. And we know we need this because we had started through the good work of Robin, Asira, et cetera, to develop a child welfare data model, a child welfare ontology. But we needed you. We needed your expertise to help inform what should really be in that technical work. So welcome, and God help us all. Okay, back to you, Adam.
Yeah, sorry for the interruption. If Paul, would you like to say hello? And Paul, we're recording this if you want to catch up with what happened before you got on.
Can I get a copy of the PowerPoint? Will that be sent? Is that accessible? Because I apologize for missing the first portion of the program. It looks absolutely fascinating. I'm Paul Freese. I'm a public interest attorney in Los Angeles, largely retired. I am basically immersed in the foster care system as an advocate, working with a retired judge named Sherry Sobel to kind of break down what we call the lack of social connections for foster youth, which has been exacerbating during COVID. They're already highly socially isolated. as a population, kids who do not achieve permanency. The kids in our group, what are called short-term residential therapeutic programs, used to be called group homes. They're on a fast track towards homelessness, human trafficking. Half have dropped out of high school. By the way, in California, if you drop out of high school, you're not eligible for a work permit. So the only thing asset you have to work with is your body, which is what I was seeing in Hollywood as an attorney working with homeless populations. Kids who'd run away from the system. So I'd rather be on the streets than how they treat me, ending up being trafficked. So we've started a thing called Simply Friends, which is a outreach to, it was inspired by Mr. Rogers, Won't You Be My Neighbor, designed to introduce the community to people, to kids in group homes, build their relationship support, do everything we can to ensure that social isolation is not the primary risk factor as they age toward adulthood, that they have people who can open doors for them, accompany them, and advocate on their behalf. Anyway, we've been doing that for about 2 years, Adam, since I last saw you. It's a very exciting innovation.
Where you changed jobs.
I love it. I'm an education rights holder for about 10 kids, meaning that the system can't get rid of me. They have to notify me whenever there's a possible placement change. These kids are moved on average 5 or 6 times in middle and high school. You can't believe what disruption that does to your education, as well as your stability, predictability, anxiety that associated with movement, ability to maintain connections and friendships that disrupted. In any event, so we've been diving into that. We've started a thing called BEST, which stands for Bolstering Education and Successful Transition. It takes a village for kids who don't have family or home, and creating a constellation of nonprofits that are proven to be devoted to helping foster kids has been kind of our primary focus point.
Great. Thank you, Paul. Thanks for being with us. It's actually probably a good time for Daniel. Anything you want to add that Brian and I missed?
Not really. No, our work has always been sort of originally started in child welfare and continues to kind of sort of touch on it again, and even more so recently, as you mentioned, in the integrated care for kids. So it is an area that is of great interest to me and first everyone else who is involved, and I think it's poignant. I will also mention the interest, or at least the awareness and the interest by some of our not only state partners but our federal partners at the Children's Bureau. So and also the Office of National Coordinator. So I've been able to sort of bring the attention to the new Associate Commissioner and some others at Children's Bureau about how important a lot of the work that's going on here, and obviously a million other places, but the work that we're doing is supporting the Families First initiative and the prevention activities that are part of the strategic federal initiatives here. So we're really very much in alignment with that. And I think, as appropriate, we can sort of touch more on that as we go forward. So.
Does anybody have any questions so far? I mean, we hadn't really gotten into what the nitty-gritty of the work will be, which I think, Brian, if you can start outlining that a bit, that would be great. But first, anybody comments, questions? Anything?
I have a quick question. When we started, we approached child welfare as being a subgroup of the oncology work group. And then there were some questions that came up regarding whether it needed its own ontology versus it's encompassed. I think the recent answer from Eric Jean was that there's a case management approach to child welfare where Department of Health and Human Services doesn't have access to the data. And it's separated at, kind of each state. And then the alternative approach is if you take the health services approach with clinical conditions, there's a FHIR tool for case management that probably, can be used for child welfare. And so I'm a physician, and have a public health background. And so what I learned from the national being involved in this is there was a diagram that was helpful to look at. There were 5 levels of interoperability: organizational, semantic, syntactic, technical, and standards. And so with the focus that we have for this, it's a domain, I think we're focusing on the domain expertise, and some of the specialty areas are brought out here are broad, and all will be useful because there's 8 classes to child welfare. But wanted to just revisit the question of whether we're not going to be connecting with the ontology work group versus it's something completely separate, or you're moving in a new direction. So
Sure, I'll take that one. Yes, Robin, when we were first working within the ontology working group, we you had actually spun out a new subgroup within the ontology working group specific to developing a child welfare ontology. And, you know, in the process of doing that, you know, you guys reached out and said, you know, we really need to have child welfare expertise here. It was my assertion that if we're going to bring in child welfare expertise, we need to set up a separate working group, independent of the ontologies working group, to pull those people together, because most of the child welfare expertise that people that we're going to bring in aren't going to have that kind of you know, technical affinity to participate in a lot of the ontology discussions that we revel in as being more technical people. And yet, you know we need to have a group that's going to talk about governance issues having to do with child welfare. What kinds of information is acceptable to share at a non-technical level? And by bringing those people together within a child welfare domain expert working group, we can, from an ontology point of view, we then have a group that we can go to say, what do you think about this particular approach to a data model, to an ontology?
I think what you have with the current group from NCAP are nobody with a public child welfare background, which might be really good. We've all had, you know, to understand them and interact with them and succeed without them, and to figure out how to get what we need from them. So I think we might be good in that regard, or have some information that would be helpful.
Anybody else? Okay, great. So I think what we need to do, and we have not done, so this will be a group activity, is figure out next steps. You know, what are the actual activities in which we need to engage in order to tap into NCAP's expertise, in order to get the technical requirements that we want to address, et cetera, et cetera. So Brian, I think, Brian or Daniel, I think Brian, if you could opine on that, and we can start figuring out our next steps.
Well, I think one of the next steps that we need from a technical point of view is for somebody to document, here's the lay of the land for child welfare. Because as you pointed out, from an NCAP perspective, you have one set of expertise, but it's not all of the expertise associated with day-to-day operations within, say, child protective services, which is not all of child welfare as well. You know, it doesn't represent some of the family services and support mechanisms that need to be in place in support of a child. And that is not fully involved because it doesn't touch upon some of the unique characteristics you might have for a child who's developmentally disabled or the blind, and so what we call child welfare as a simple moniker is actually a fairly complex landscape that needs to be defined so that we can then come along from a technical point of view and say, okay, so if we're going to model data associated with the developmentally disabled, what's the overlap between that and the data that we might model for child protective services, and what's the overlap between that and what we have to model for children in the juvenile justice system, and what's the overlap. So the first step is defining what is child welfare out in the big bad world. The
Well,
second
do we need,
step,
sorry,
Go ahead.
do we need child welfare in the whole big bad world? And this maybe is a question for Christine, or do we need child welfare as it applies for Inc. as it applies to Inc. so that, you know, we're narrowing, because that's a big world, so that we are focusing on the most immediate tasks, so to
well,
speak.
that was the next sentence I was going to make.
Oh, I'm gonna,
You guys are-
Brian, when you're done, just say done, and I'll keep quiet until I hear that word.
The Adam
I was
and
gonna
Brian
say-
show here. But yes,
Yeah.
I think we have to narrow, right? I mean, right now, as you both agree, otherwise we're trying to boil the ocean. So I think if we're thinking about, we want to focus here on the interaction for sure between child welfare and healthcare. And then recognizing that there are other connections as well, that child may be justice involved, and I know there's a technical term that's used for those kids that's eluding me right now. But and certainly other not medical care, but other health care and other social services that child or their family may be obtaining. So I think it all comes together, but I think that main point of connection is that sort of healthcare to child welfare, knowing then. But again, if we're creating an information system, like one, you know, thing that people have tried to do, for example, in San Diego, which maybe some of you Californians are familiar with, the Community Information Exchange in San Diego, which has a community level case management person record, right? And I've not seen one for a child welfare involved child, but in theory, there could be enough there that anyone who is partnered and to whom that child and family have given permission to see that record, you know, they would be privy to that that information about that child being involved in the child welfare system and having a medical diagnosis of XYZ. So, and whatever else might be there, maybe being in subsidized housing, et cetera. So it is the whole big bad world, but I think if we can start between what does child welfare want to know from healthcare and what does healthcare want to know from child welfare, that's a good starting point.
And what I was trying to get across is that from an ontology point of view, we need to know the broader lay of the land, but not any of the details. So we need to know what the big pieces are to child welfare. And then we can say, okay, what we need for integrated care for kids, for instance, this connection between healthcare and child welfare systems, is this particular part of it. Then we can define that the details. We can dive deep into the details for that particular part of child welfare, but do so in the context of what the bigger picture is, so that we don't end up technically painting ourselves into a corner. Over.
Yeah. And we really haven't done that. I mean, it didn't get done in New Jersey before I left the project, like that very sort of nitty gritty conversation of what I said. What do you need to know? Obviously, you don't need to know everything. Do you need to just know binary information? Yes, no, they're in this program, or is there more nuanced or detailed information that is critical to being able to properly provide for that child?
And in the fullness of time, you know, this particular group may go on to say, hey, look, we've got multiple different little sub projects or subtasks we're working on. We're working on this particular project for Inc. We're working on this particular project for, as just popped up from Paul in the chat, on fetal alcohol spectrum disorder of foster children. That's great. I encourage you folks to figure out amongst yourselves, what are the important things to talk about, to think about, to document, and to push over the wall to the technical folks in the ontologies working group or the technical folks in any of the other working groups to help solve, so that we can get this interoperability enabled between child welfare and healthcare and other systems.
So I'm trying to, the clock's going to run out. I do have a hard stop at 11 and I think at 12, sorry. And I think other people do as well. So I think and please everybody pipe up if you disagree, but I think the next step should go offline for a few of us to put together something like what Brian's suggesting and what Christine is suggesting. You know, what are the big issues and big factors, and where are the intersections? What are the needs to know? In broad terms. One question that, and I would suggest a little subgroup, and this doesn't have to be, again, a heavy lift. I think, you know, off the top of several people's heads, butting heads together, that's probably pretty readily done. And I'm thinking Rich anybody who wants to be can be on that group. But one question and that can be sort of a laundry list of items with very brief explanations. But I wonder if it's time yet or not to start with to make up a use story, to show an as is, you know, here's to tell someone's tale and the consequences of that information not being shared in some demonstrable way with, you know, with pretend humans attached, or should we first get that laundry list together so that we know what we're starting with? Anybody? Or not?
I just popped into the chat the notion that the classifications, that the classes, their domains that Robin had written up, you know, would be a good start on describing those, would be a good start on a 2-pager introducing the child welfare domain, and that perhaps along the way, as part of that 2-pager, you could identify a representative user story in, for example, an integrated care for kids environment.
So the only comment I have, what I can send would probably, I think would be helpful is for me to send to Christine the table of Schuler class domains, because I know she has a metric background with the domains that are accessible through the Schuler Center website. And then from that, I think Asaya Lin had me just map the definitions through the MESH and another classification system. So that's a starting point. And so for some of the domains, there's no mapping definition. And so it may be the group's decision to pick one of the domains versus try to create a definition for some of the domains, given everybody's diverse, you know, expertise. But as a start, I can either send it to the whole group or send it to Christine, but I think it may be helpful. I don't know.
We'd all like to see it.
You all want to see it? Okay. So it's kind of in rough draft form, but I think that like what I would like is for somebody else to kind of take the lead. Like I'm happy to kind of give feedback and work on it, but I'm not a domain expert in child welfare. I have more of a public health and a pediatric background that I can give some interpretation. And the only problem with the use cases is it'd be helpful, like for somebody else in a system to develop like the topics for the use cases could be one in each of these 8 domains, a foster home, a foster care, you know, like that could be a starting point. You know, it could evolve into a different place, but I don't have access to the data to develop a use case. So if somebody else is in a system where they can have access to that data, that would be helpful. But I can definitely provide feedback to it. So, but I'm happy to, after the call, should I send it to you, Adam, for you to distribute? I don't have everybody's email list, or who should I initiate sending that to?
That's fine. I'm fine with that.
Yeah,
if I could get a link from the appropriate people on this call, a link to the recording of this and to the PowerPoint I can aggregate all this stuff and Robin, the document that you're going to send us, and I'll just take a look. I'll send it to the group, to other NCAP folks who might want to see it, and I think we'll figure out next steps offline. We'll schedule another meeting with an agenda, and off the top of my head, I think turning that, what you're providing us, Robin, into a 2-pager with 2 or 3 people working on a first draft of that would make sense.
Yeah, I just have it in table format, but it gives you like the approach we were working on that were suggestions from the group. So so keep in mind it's in table format. So
That's fine.
It makes it easier to start with, quite honestly.
It's
so that's
something to
good.
start. It's something to start.
It looks like Rich is volunteering, so that's good.
Yeah, I hope Rich would volunteer. So that's great. But that's a start, and we can do this. I do have a hard stop. I apologize. If anybody wants to keep going, that's certainly fine with me. But we can set a next meeting date with an agenda and these documents offline. Is everybody okay with that?
Sounds good, Adam.
And one of the agenda items for the next meeting probably ought to be identifying a potential set of co-chairs. Adam, unless you really want to continue to be the co-chair of this thing.
No, I think I interrupt too much to be a co-chair. This is all stuff I think we can take offline, and yeah, I think if people have time, and again, I'm just afraid of people thinking, oh my God, I can't take on another job. That we do not want that to be the reality here. So if people have time, please let us know.
I run on too much to be the co-chair. So please.
Adam, I would make one point here.
Yeah, please.
That, this work is embedded also in the broader work we're doing in one of our major initiatives at Stewards, which is to try to enable this whole process of information sharing through work we're doing on creating an informed consent utility, a way to make sure that the people who we are trying to help and serve, and the helpers that are trying to help people, have the ability to actually obtain the consents from those individuals, parents, guardians, children, so that information can be shared in a responsible, secure manner. We know that the inability to share information due to the inhibitions of the hurdles of consent is huge. So this work would be informed by and would be information for that consent work that we're hoping to implement at scale in a number of different jurisdictions over the next very short period of time. And this would be embedded in the middle of that, since so much of the work is based on the integrated care for kids work, and a lot of the technical work that Brian sort of referenced is embedded in that as well. And the subject matter expertise, being able to bring that to the table would be incredibly valuable. So the work group itself nests within a larger project and a larger initiative that actually has national attention now and philanthropic attention. So we're hoping to be able to sort of support, rarefy, and sort of accelerate the work going forward, and hope to be able to do that very, very, very soon. So there's a timeliness to this group, not just from anywhere. Okay.
Terrific. Thank you all enormously for showing up, for participating. I think there's some real potential to do some good in the world here. So thank you, and stay tuned.
Okay,
Take care all.
All right,
Okay,
bye.
take care all. Thanks.